I'm Victoria Boise. I'm the Managing Director for InMode UK and Ireland.
I'm Dr. Saleena Zimri. I'm a cosmetic doctor of 15 years and owner of Skin Doctor Clinics.
Hello Saleena, how are you?
I'm good, thank you. How are you?
Good, good. We're here to chat a little bit about InMode and the devices and the treatments that you've been offering at the clinic. But how long have you been working with InMode for?
So around 6 years now. Yeah, quite a long time. Yeah, it's flown by actually, yeah.
And what do you love most about InMode?
What I love about InMode is, I guess, the variety of technology that you can get from one platform. I mean, we have 2 different types of platforms currently across our clinics. And I just love that the tech is so high-end, but it also has something for everyone. So that's kind of my favourite thing about it. I think aesthetic medicine now is so bespoke to everyone. We don't do the cookie cutter thing anymore. So we need platforms that kind of back that up.
Yeah. Which platform have you got?
So currently I've just upgraded. So I have the Ignite, and the Optimus Max, do you call it now?
Yeah, the new one. Fantastic. I know previously you had our body type platforms and you've been doing Facetite for a long time.
Yeah.
Queen of Facetite, we like to call you, because you do the most amount of Facetite in the UK, business-wise, which is amazing. Saleena, tell me a little bit about your signature treatment, Jawtite.
Yeah, so obviously I've been using the system for 5 or 6 years now. And over that time, I started with Facetite first. And as with anything, it's experience, isn't it? And it took me a year or 2 to kind of figure out my own kind of version of that, how I would use it, how I apply it to different types of skin, different ages. And then eventually I developed my own techniques, which was a little bit outside of the classic Facetite. But essentially it's to hone in on this kind of troublesome area. And then it kind of blew up over COVID because everyone had tech neck and they were sitting at home looking at themselves, and the jawline became the thing to treat. And it just blew from there. So really the aim for that treatment is to focus on the lower face, so from the corner of the mouth down. So we're talking jowls, jawline, double chins.
Everybody doing this.
Exactly, yeah. And no one, not everyone wants to go under the knife, and it's been a fantastic plug-in for that middle ground treatment where someone doesn't want quite surgery, but they don't quite want the other stuff either.
Who's it for?
Well, this is the thing. It can be for literally anyone. So there is no age, that's typical. I'd say you could start as young as, some people genetically have fullness under the chin. So I classically treat young girls in their early to late 20s who, they're not big girls, they don't have high BMIs, they just have genetic pockets of, perhaps a double chin or perhaps kind of early jowls, weak chins, that kind of thing, or laxity because of just their type of skin. Up to postmenopausal ladies who have got age-related changes. So yeah, it's something for everyone. I guess, we have to be realistic, and I'm quite good at telling my patients this is not surgery. However, it's going to give you a really nice result.
Is there anyone you can't treat with it?
I'd say if they're extremely lax, then, you have to be honest with people. And I think, I'd spend that money somewhere else and actually get that skin and muscle cut out properly and get it straight. Yeah, facelift. So, there's always going to be a cut-off point, and it's having that conversation with the patient.
Would you say it's the closest you could get to a facelift without having a facelift?
100%. I'm not even joking, hand on heart, I'll show you pictures of women who have come to me a year or 2 after facelifts, not being happy, and I've been able to give them a better result.
That's amazing.
Because truthfully, if you're going down the facelift route, we've got a number of layers in the face, and just tucking the skin back isn't going to cut it.
No.
You need to go through that fat, you need to improve the muscle, you need to improve the skin. And a lot of the time, people are doing these shortcut surgeries where it is a 10K nip and cut and lift. It's not reducing tissue.
No. So you're not getting that tissue contraction.
Exactly. So, but we can do that. We can do that with Facetite. We can do that with Quantum. So, and it's that difference. And they think, oh God, right, I didn't know that. But truthfully, if they were going to go down the surgical route, it should have been a deep neck lift rather than just a quick one.
And that is not for everyone, is it?
It isn't. No. I mean, it comes with downtime, risk, cost. And I think that's why it's become such a popular treatment, because I myself wouldn't, if I was in someone's shoes and a surgery would be the last thing I'd want, really.
Yeah, me too, actually. You can't, I think especially, I mean, we're lucky because we're in the industry, so we get to see all the treatments that are available, and sometimes consumers don't know what's available. And I think if I could have anything that wasn't surgery, then I would totally go for it. And then you trust your doctor, that person that you build a relationship with, to say, actually, can't do any more for you, you have got to go under the knife. So it's kind of finding that balance.
Yeah, I think postmenopausal, fine. You know, a facelift could last you 10 years plus. But if you're younger than that, you know, there's only so much skin we have. So if are you gonna do that every 10 years? Cut out, I'm gonna run out of skin, basically. You know, so yeah, I think there's always room for that middle ground treatment, and this is like the perfect solution for that. Yeah.
Is it a one-off treatment, or is it something that we come back for?
I usually say maintain with things like Morpheus, yes, because I think that is the best thing for, again, continuing that contraction. Obviously, we can't stop anyone aging, so every year there's going to be an aging process that occurs. So I always say to people, look, you need to think about that. You could do nothing, and then in 5 years' time, you're going to be sort of similar again, and you could repeat it. But in an ideal world, you want to prevent rather than treat. So I say something like Morpheus A. It doesn't have to be that often, maybe 3-4 times a year. Should be more than enough to keep the skin contracted.